President and CEO of Easter Seals. I'm so grateful for all of you joining us today, and especially our two guests that will be sharing a little bit more about their experience with mental health, the services provided by Easter Seals Michigan, and also with one of the individuals that has actually received services from Easter Seals, Miss Denise Bailey. So with me today are Julianna Harper, who is the Chief Program Officer, Senior Vice President of Easter Seals Michigan, and Miss Denise Bailey. And I am so thrilled that both of them are here to talk about mental health and mental health awareness. What some people are saying is that we are seeing the second wave of the pandemic, and that second wave has to do with mental health. And when we think about what's been going on with the pandemic, we talk a lot about social isolation. And with that comes loneliness. What has also happened as a result of the pandemic is people have not been able to get out and about the way that they normally have been able to do so in the past. We've also seen people lose their jobs. We've been seeing people unable to pay bills. All kinds of issues have just become an avalanche against individuals across this country. And so certainly our heart goes out to everyone that has been affected by the coronavirus. What we want to talk about today is that mental health awareness is extremely important. And what I do want to share is that this Saturday is World Mental Health Awareness Day. Now, according to a recent study published in the Journal of the American Medical Association, nearly a quarter of the people in the United States are experiencing symptoms of depression. That's nearly 3 times the number prior to COVID-19. And those with lower incomes, smaller savings, and people severely affected by the pandemic, either through a job loss, as I've mentioned, or the death of a loved one, or the sickness of a loved one, they are more likely to bear the burden of having these symptoms of depression and loneliness and all of those feelings of mental health crisis. So this is a very timely discussion. It's one in which we want everyone that's listening in to really stay attuned to your own feelings and emotions. Be very aware of your loved ones, how they're feeling, what they potentially could be going through, because who knows that you could be that very lifeline to save someone from just having a complete breakdown and being able to be the person to direct them for help. And of course, self-care is extremely important. So as I said, I am so thrilled today to have joining us two very, very special women, Julianna Harper with Easter Seals Michigan, and again, Miss Denise Bailey, who has been a recipient of the Easter Seals Michigan services. And she's going to share a little bit of her testimony with all of us. But Julianna, let me just start with you, because the fact is that the American Medical Association is reporting that 3 times the number of people before the pandemic are now experiencing symptoms of depression. And I know that your Easter Seals affiliate, Easter Seals Michigan, has been doing a lot to support people in the state of Michigan. So my question to you is, have you seen the increased need for behavioral services in Michigan? And can you talk a little bit about what it is that you all are seeing, how you all are responding, and what you would recommend to people that are having these feelings of isolation or even depression?
Thank you very much, Angela, for having us here. This is such an important topic to us, and we feel very welcomed and with your warm introduction. So Easter Seals Michigan, we are predominantly a behavioral health provider here in Michigan. We serve probably a little over 13,000 individuals annually. So that's a lot of individuals that have either adults or children and their families with serious behavioral conditions or a wide variety of different conditions. And I think since COVID had, the pandemic had started, we obviously pivoted just like any other provider did. We had to shift all our in-person services to a telehealth platform, which we did within a couple days. And so we didn't have an interruption in service. And I think that that was really an essential thing. We felt we were essential workers, and the government felt we were essential workers. Our doors remained open. So we did a combination of telehealth visiting, either audio or video, and then we also provided services in person. What we saw, and which was concerning to us, was we felt like the public may have thought we were not open. And so we needed to, we really needed to push our awareness out to the community that we were still available and we were still here, open doors. We did see a decrease in amount of intakes that were coming through outside of our normal routine. I think we were, it probably was half of what we were used to seeing coming through the front door. And that happened for between, let's say, April and then July. And by July, referrals started picking up again. And I think that's what, as you referenced, there was some lifting of restrictions, but there was also at that point, I think people, the pandemic, the second pandemic of mental health or crisis, they held on so long until they couldn't hold on any longer. So I think that when they sheltered in place, everyone, they hunkered down and they did what they had to during that period of time until they could no longer. And I think that and we're seeing that for sure in the data. So it's unfortunate because COVID, it affects everyone. It affects every single person and their daily routine. And that kind of chronic stress over time really wears down immunity. It wears down on your adds mental fatigue. It increases anxiety. There's a whole variety of different ways that it manifests itself, and it manifests itself very differently for each individual. And I think that, you have on top of that, the grief and loss. You have grief and loss of what you can't do. And then that spurs different emotions for people, for fear and, again, increased anxiety, depression, and people don't know where to go. They don't have their same outlets. And I think that that's really unfortunate. We were really focused on that as our organization really focused on the social media aspect of it, because when you lose your main sort of connectedness, the only thing that was there for individuals is media, whether it's social media or TV or news, podcasts or telephone. It's not the same. It wasn't the same kind of interaction. So we felt that when the whole community is focusing on fear, that if we could flood our website and our social media with stories of hope, then and to let people know that there's ways to look at assessing your own mental health, doing screenings on your own well-being, reminding them that we're here, our doors are open, having testimonials about people getting better and being connected and how you can adapt in different ways during these times. We were trying to get that out there to instill and keep instilling hope, because we felt that would combat some of the fear that is so present. Unfortunately, I think that there's still a big perspective about how it impacted certain populations, and that there's health disparate populations out there that were more impacted than maybe other populations. And we were very mindful of that as well when we started thinking about our seniors, people who weren't accessing care. Where were they? And how come they're not accessing care? Did they think that they couldn't? And I think that was the biggest thing of, if your doctor's office isn't allowing you to come in, why wouldn't you think that a behavioral health or a mental health therapy office may not let you in either? So
You
Um,
know what, Juliana, I just want to interrupt you because you've laid a lot out there, and I want to unpack it at a few bits at a time. But before we do that, I'd actually one of the key things you just said is at the outset. When people thought that your doors were closed, it helped to say online we are open, and also to start sharing stories. So I'd like to just ask Ms. Denise if you wouldn't mind, before we come back to Juliana to talk a little bit more about the services, tell us a little bit about yourself. Tell us about what you experienced during the outbreak of COVID, and what's happened in your life, and what have you gone through in the last couple of months?
Okay, hi. Thanks for having me here. I have went through a lot over these past few months, especially with the being alone. I'm 64 years old and I live alone. And one of the big issues that I had was when I needed to have back surgery, and due to the pandemic, they kept canceling my surgery because it wasn't it was only an elective surgery that they said. So it got canceled about 3 or 4 times, and I was in the house alone. You couldn't, my kids would bring over stuff. I couldn't go to the grocery store because I couldn't stand very long. So they would do my shopping and bring it to the door. Then I, go out and get it, but it's still not the same. I was very alone and I was depressed. I couldn't see my grandkids or anything like that. And it had just got to be a lot. And then I was on that medical and I couldn't get, they wasn't paying me enough. Plus unemployment wouldn't give me anything due to the fact that I was unable to work because I was on a medical. So it was really rough. I didn't pay my rent for a month. I think it was April. I didn't pay anything because I didn't have any money coming in. And so when the money did start coming in, it wasn't coming in enough, you know what I'm saying? So it was rough. And then by having to be off work, and I work in a hospital, I've worked in a hospital for 27 years. And now that I'm 64, I didn't want to go back. I have a lot of illnesses. And so I retired last month. So that was another thing I had to go through. That was a lot. So it's just been really rough.
Yeah. So, just listening to you, thank you so much for sharing too, by the way, but just
Mhm.
listening to you, you just had so many various factors. Just one of those things alone would
Right.
have really caused someone to break down, but you just had multiple things happening with having to have back surgery and that being put off, and then not being able to stand long, and then being alone in the house, and then
Yeah.
your money being impacted, not being able to pay rent. I mean, it's just that just compiled, and I guess it just kept coming and kept coming and kept coming. And so what happened? How did
Well,
you
what took me
feel?
over the edge was my daughter shot at her baby's father.
Mhm.
And that just like took me over the edge. I was there with the kid and she shot at him outside. And I never would thought she would have done that. And, it just took me over the edge. So after I got things calmed down and he left, I came home and cried my heart out. And I was crying and so upset and nervous. My stomach started hurting,
Mhm.
and I have diverticulosis. And when it hurts, it develops into diverticulitis. So I
Mhm.
went to, a regular hospital, in the neighborhood to see about my stomach, even though I knew I was having a lot of emotions. And when I got there, they knew I was having a lot of emotions because I still kept crying and whatnot. So they actually put me in a part where the psychiatric patients be inside of the emergency room. And,
Yes.
they have the doctors there, the nurses, and the social workers. So they kept me there for 2 days. And from there, I went to Common Ground. Common Ground kept me there for a few hours and sent me home. No, he sent me to, what's that, One Oakland. So I
Mhm.
went to One Oakland. It was like a group setting where you sit around, in groups and talk about what's going on with you. And, a lot of those were like kids, my daughter's age. And I just felt like I didn't want to be around that big group. I
Yeah.
wanted to do like a one-on-one. And that's when they introduced me to Easter Seal, where I could have like therapy one-on-one with the therapist, one-on-one with the doctor, case manager, and like that. And that worked better for me, but it may work better for some in groups, but just for me, it was better for one-on-one.
Wow. And I just so sorry that you experienced that. How are you feeling now?
Now I'm feeling pretty much okay. I still have, issues going on, but I'm trying to move from the house that I'm in because it's too much. So I'm looking for something for a senior citizen now.
Yes.
Yeah.
Yes. And so you went to Common Ground. Is that a counseling center?
Common ground is, I guess, where they send you to be evaluated by a psychiatrist. And
Oh,
I was
okay.
evaluated by the psychiatrist, and I
Mm,
guess they felt that I wasn't, I didn't need that much of care at
mm,
Common Ground. That's
mhm.
why they let me go home and do the outpatient therapy, group therapy for a week and a half. I did that for a week and a half. And
Yes.
then after that, that's when I came to Easterville.
Well, how's your experience been working with Easter seals?
It's been pretty good so far. I've talked to a case manager. I haven't talked to my therapist quite yet, but I've seen the psychiatrist. Everything seems pretty nice here. I like it.
Oh, well, I'm so glad that Easter Seals has been able to help you and to be a supportive part of your life. Are there any, if you were just speaking to someone who is currently going through this exact same situation or something similar, what words of encouragement or lessons learned would you share right now?
Well, first of all, I would tell them, don't hold anything in, because that really affects you when you hold all your stresses and anxieties in. Just go to your local hospital, anywhere, and get some help. Speak to somebody, talk it out. Don't try and hold on and do it yourself, because there is help out here to help people.
Yes, yes, and I think I found just in a lot of different communities and different populations where people don't feel comfortable talking about their mental health issues,
Right.
and if they're in a crisis, they don't want to share it with anybody, or they think they can just power it through, and I'll make it through.
Exactly.
I'm going to be okay.
Exactly.
Um, but you know what? I say yes, prayer works, and then God also provides us with people to walk
Right.
alongside us and to give us
Right. Tools.
the tools. Yeah, that's exactly right.
Yeah.
Yes, yeah. So, have you been able to even share some of the lessons and experiences that you've had with other people in your family, or? Uh,
Yes, actually, my daughter, I shared and I gave her the number. This is one of my daughters. She's 30. She actually the one that shot at her baby daddy. She had 4 kids from 5 down to 1, and she works from home. And she needs an outlet to talk to someone too. I mean, she tries to talk to me, but you can't always talk to your mom. You have to have someone else. And I gave her the number. She's been calling and talking to someone. So here
oh,
at Still.
oh, that's good. That's good.
Mm-hmm.
And you know what, Juliana, Miss Denise just brought up a point which I think is actually just incredible in the sense that we have so many parents that have kids at home and they're trying to help the children with school learning, online learning, and
Yeah.
we forget that's a whole other stressor. Can you talk about that a little bit, Juliana, what you all are seeing and how you're helping parents cope?
So, right, you don't go into this thinking that you're going to be a parent, uh, a worker in whatever role you're in your job or your profession, and then on top of that, a teacher, all in one setting, all at the same time, and trying to navigate that is incredibly stressful. I can speak from experience. I think we've all probably had some level of, and with school age children, it's very challenging. I think what we saw, at least initially in the pandemic, was that families were pretty resilient. They were probably the more apt to adjust to a telehealth video sessions with us than because it was easier. And they didn't have to cart around kids for appointments and things like that. So it was very easy to connect their children to us. And we actually had higher success and less no-show rates during a period of time. That part was good. What the other part is, there wasn't a whole lot of parent support. And especially, there's no respite. There's no breaks for them, especially when there are safeguards in place and you have to stay home. So, and kids didn't have the same outlets. So then you have all this worry about, are you doing the virtual learning correctly? Are you adjusting to the changing as a school setting started back or not started back, or you had to make choices between remote or in person or hybrid, or it's all very confusing and ambiguous. And without, a lot of people do better with structure, kids do better with structure. And I think, so you have regression of, in treatment for some settings that had to close. Let's say children with autism that were not able to fully go into, or their parents weren't comfortable having them attend like a clinic setting for their, applied behavioral health treatment. You're seeing regression in that. And so it's very difficult. And then trying to manage that with children with, special needs, or who are on IEPs going back into a school setting, or still not getting those supports at home where they need speech and language and OT, occupational therapy. It's very challenging.
Yes.
And it's a lot for families to navigate. So I think we started some support groups for family. We had our youth peer and our parent support partners. And you didn't have to, we just offered it. We opened it up and said, let's have this forum for you. We did virtual day camps, which had to use a lot of ingenuity to keep adolescents engaged for a period of time. And those were quite successful. So there were different ways that we had to figure out how to work with our families. But I still think that there's a great need. And, I don't know that, we're, where you think that therapy is one aspect of it, but there really is still parental support, because there's a lot going on, and they need a place to be able to vent their frustrations in an appropriate way and learn some coping mechanisms that are going to help them. I know on our website we have some coping mechanisms for parents and adolescents to kind of think through we're doing healthy living series with our youth peer mentor, working with adolescents and thinking about this new normal and how to balance all that. So there's a lot there for parents for sure.
Yes, and I think we also put that on the easterseals.com website. So I would just encourage people, if you're looking for tools and resources concerning mental health, concerning support for your children as a parent or caregiver, please go to our website, which is www.easterseals.com. Julianna, there's something else that's on your Easter Seals Michigan website, which I think is a really unique tool. And I believe it's called MindWise. Can you talk about that a little bit?
Yeah, so we started working with MindWise about 3 years ago, part of an initiative to offer an anonymous way for individuals to screen themselves on their mental well-being. And the whole focus was really a catchphrase, a checkup from the neck up. And so that's what's being promoted actually today at our Easter Seals Michigan website. There are several different screening tools on there. There's this general mental well-being screening tool where you can go in, answer questions, and it'll tell you at the end how well you're doing. And if it scores a particular high, it also will give you some resources to think about how to address that, or maybe where to go to get help. And then there's very specific screening tools in there for post-traumatic stress, depression, anxiety, alcohol use, opioid use. So there's a variety of different things out there for individuals to really kind of basically see how they're doing. And if they're feeling as if there's a problem, then there's likely maybe a problem. And that there's support, there's options, there's a lot of opportunity for people to get connected to care. No one should have to suffer, whether it's a physical condition or a mental health condition. There are options. And maybe the first part is just checking in with yourself. And then there's a whole slew of other things you can do of maybe you do need to take a break from social media for a little bit. Or maybe you do need to get connected on social media with a support group. There are lots of different things, but breathing, meditating, all these things that you can even do from the comfort of your home.
You know what? I like that phrase you just used, a checkup from the neck up. That's good. And Miss Denise, I heard you say, yeah. Anything you want to share based on what you just heard Julianna talk about?
She wanted to know if you had something to share.
Oh, no, I just want to make sure that, when people see people that, that may even look like they don't have anything going on, they look nice, they're clean and all that, don't think they're all together, because sometimes they're not. It's the inside, what's going on with people. It's not the outside.
Yes. Yes, you are absolutely right. It doesn't matter how much money you have or how little money you have.
Exactly.
Circumstances can come at you in a way that just knock you off your feet. And you have to just gather yourself. And that's where taking that time for self-care, knowing the tools, like Julianna just listed different things to help us, whether it's, get off social media or stop watching the news if you're getting depressed about all the bad news.
Take a walk.
Take a walk outside. Yes. Right. Enjoy nature. Just do something fun. Get a hobby. What I am intrigued about is how many people took up baking and this whole thing about baking sourdough bread.
Right.
It's just sort of funny. I will tell you this. I had this thought at one point. It's like, I don't think I want to bake bread. And then I thought, I wouldn't mind learning to crochet or needle, knitting. Haven't done that, haven't gone to get yarn to pick that up. But I just thought about those are the kinds of things that we just have to do to just relax.
Right, calm your nerves.
Calm your nerves. And it's important too that when even those tools and those things don't necessarily alleviate all the pain and the stress and the anguish and the anxiety, that we still seek out the professional support. Right. And we can't overemphasize that enough, that having someone to talk to, being able to acknowledge that you are in a crisis, that you feel like your world is falling apart. And I just think it's so important to be real. It starts with acknowledging that there's a problem. Right. Is that right?
Exactly.
Yeah. Julianna, what other, we've heard great success story with Miss Denise and that she's still partnering with you all at Easter Seals. Any other stories that you could share about what different families or individuals may be doing to cope with their stress and anxiety?
Well, I think, Denise is a good example, maybe not the normal routine of how you enter into mental health treatment or therapy, but the point is that she went to they sent her to a crisis stabilization to see if she needed more long-term hospitalization, and they didn't feel that she needed that level of acuity, which was great. Mm-hmm. Because we feel that people can get better in their own homes with the right supports.
Yes.
And so we look at it in offering a lot of different things, from peer, youth, your traditional therapies. We use evidence-based practices, and I think that people will come in and they'll be matched based on, let's say, maybe it's cognitive behavioral therapy, or maybe it's something a little bit different that they need because of the trauma history, and all of what's happening is triggering them different. We've had individuals that didn't have a safe place because they were experiencing more domestic violence. And we had to modify our approaches in order for them to have safe words. Because we're doing telehealth, they're in their home, and the person who may be abusing them is also in the home. And so we had to figure out some unique ways to work around and provide alternative approaches in order to get people the care that was going to best work for them. So it's very individualized, and I still want to say it's person-centered. So if for our children in our autism, we weren't able to necessarily do our applied behavioral analysis therapies like we always do, but we modified it and we started doing toilet training in the home virtually with an iPad. And we set that up and it was a very successful. We had a couple rounds of that worked very well. And now learning from that, some good things came because we'll keep doing that for other families. And it's a natural environment for that child in their own home to learn. So we had to modify our practices a bit to be a little bit unique. I mentioned doing virtual camps. That was another way that we had to modify things, but we are probably about 70% telehealth still and 30% in person. And we think, obviously, we believe that in person is more effective or efficient, but until the studies come out that showed telehealth may just be as equally effective. So we believe that there's a place for both.
I think that it's commendable how Easter Seals across the country was able to pivot quickly and efficiently to start using telehealth as a way to stay connected and to provide the support and services that people need. But obviously, it's not always perfect because there are a lot of factors that include a person's access to internet. It includes a person's access to a device to be connected to. Can you talk about that a little bit, Julianna, and your experiences with that?
Yes, so that's a great segue. The challenge of providing telehealth is that you might have an iPhone, you may have some kind of smart device, and you can connect that way. But that family also might have children that are also doing virtual learning at that time, and you might get booted off your connection, or the connection's not good enough, or maybe they were using Wi-Fi from other sources like libraries and other means, and they don't have Wi-Fi at home or connectivity at home. This was a lesson that we had to learn pretty quickly of who was able to connect and how they got connected. We did visits by phone when video didn't work. Now we're almost all video, but we had to apply for grants. And I think what part of the innovative thinking was, if we could apply for grants for technology, and we also applied for grants that also paid for some connectivity with the loaner equipment that we were bringing out to individuals. We looked at it from a population health perspective. Who are the most at risk that we're currently serving? And we created a risk algorithm report that based on the CDC risk factors. Mm-hmm. And we targeted over 500 individuals that hit the highest risk for COVID, on top of having a whole bunch of other comorbid conditions, behavioral health or medical. And we felt that they needed remote monitoring in the home. So we added blood pressure cuffs that could connect to our system so that we could be monitoring remotely, as well as doing the video. We could ensure that there was some video connection, and we added some telehealth support in there to make sure that it all worked, because we didn't anticipate early on the amount of effort that goes into making sure people are connected from their site and our site and wherever our med staff are or our therapists are. There's a lot involved in that process. So we were very fortunate to get grants in order to do that and to sustain that for a bit of time. And then I believe that will be part of our normal routine.
That's wonderful. And I think you're saying something that everyone needs to understand, that there are, and it's been made clear with COVID, that it has not attacked certain populations equally. And on top of that, you have the technology gap. And so there are all these factors and challenges to be able to continue to provide the care and support and services that people need, especially this vulnerable time. So one, I'm grateful to those, whoever funded you all and gave you grants to do that work. But secondly, I hope that policy officials, all the key governmental officials are aware that this is a population health crisis and that we need to provide those that are delivering the services on the ground, the tools, the support, the financing, the regulations to be able to deliver these services. And it's clear that Easter Seals has been doing that and doing that well. And it's just, I'm just really proud of how you all are just a poster child for demonstrating the great work of Easter Seals on the ground across the country. So thank you for that. And I wanted to say that because you never know who sees this video, to just let them know that we have this on the ground, hands-on support across the country. And we have caring and supportive staff in Easter Seals staff that walk alongside folks like Miss Denise and so many others at their very important moments of crisis. So I just want to put that plug in. But Julianna, is there anything else that you would like to add or to say, or you think that it's important in terms of this being mental health awareness and getting the message out to people?
Thank you for the kind words, first off. The staff here work very hard. And I think sometimes we forget to remind and be thankful to them because they show up every day. And so I'm very proud of our staff. Secondly, I think that obviously, please go to our website. It's eastersealsmichigan.com and do your checkup from the neck up. We want to drive folks there because it is important. We want to lead by example. And, luckily today I'm doing okay. So I'm like, all right. But it was good to test it out and to see and what other options that are available to folks. And there's a lot of resources there. So if you have an opportunity, I do want to say that the 500 that we have of, that we're targeting for equipment is a drop in the bucket. We could do more. We serve 10,000 and plus individuals every month. The need is great. And I don't think that people understand it's not just in mental health, depression, anxiety, it's addiction. And I think we have an addiction crisis just alongside that we do a mental health crisis. And a lot of attention needs to be paid attention to that area. You have 25% of alcohol sales through COVID. That was an increase. And then the opioid deaths have increased, I think the University of Baltimore said, by 18%. So we know that it's on the rise, and there are programs such as ours that are out there willing to help, and our doors are open.
Yes, thank you for that. And Ms. Denise, what else would you want to just say to someone who may be just tuning in right now? What words do you want to share with them about mental health?
I would like to say to the young mothers that's out here that may be going through something, even though you're going, because my daughter, it's real. So my daughter is going through something and taking it out on their kids. When they take it out on their kids, that's not good. They need to get some help, talk to somebody, but just don't, take it out on anyone. Just be able to talk to someone because they take it out on their kids because the kids are around them all the time. And, it's sad. It's really sad.
Yes. Yes. Yeah. And you know what? You raise a good point in that we have a whole generation of children now that their world in an instant was turned upside down, and it's a defining moment in their lives.
It is.
And so we have to do what we can as professionals supporting grandparents, supporting loved ones, caregivers, family members, to really be intentional about our children, our youth, and helping them to walk through this crisis, to cope with their emotions and their feelings, because they may not be able to articulate what they're feeling. They may be acting out. We may want to say they just acting up, acting bad, not behaving, and not understand that they don't know how to express. Even if when adults don't know how to express their emotions or feelings, how can we
Exactly.
expect a child to do that?
Right.
So we really have to be thoughtful. We have to be aware. We have to be attentive. And I just want to say to folks, go on the Easter Seals website, take a look at the tools and supports and services and the programs that we offer. Call us if you need some help. Even if we don't have exactly what we need, we will do our best to get you connected to the right people, the right organizations to provide support. Listen, we all have to do our part. We have to support each other. We can't isolate now. And this whole notion of social isolation and social distancing, at the end of the day, we weren't made to be alone. Human beings were not made to be alone. And if you didn't know it before, you ought to know it now. Right? So,
Right.
and I know I'm preaching to the choir, but I really mean that. I want folks to know, reach out and connect. Don't ever suffer alone in silence. And, the other thing I will say, before I turn it back over to you, Julianne, just for a few more words, but the other thing I would say, that the checkup from the neck up, it's a daily thing. And so you don't do it once and say, okay, I'm good. And it just may be that you had a great day and that was a good day, and that's good, that's wonderful. But if something happens the next day, go back, do another check-in. It's this continual thing about self-care that we have to be intentional about.
Exactly.
Absolutely. I think that you hit it right on the head, because we're not static, and our moods change, and like I said, it manifests differently. It could be coming out in a stomach ache when it really is about depression. And you go to the hospital like Denise did for what she thought was a physical condition, and what it was is she needed help with depression. And so it comes out in different ways, and just listen to your body, listen to your mind, listen to your spirit. And when you have that doubt or you feel like your anger is coming out too much, you feel that you can't control your thoughts or your emotions, that's when it's a good time to reach out to someone who you feel safe to. There's what I worry the most about this time, and I think that there was some concern about the level of individuals that would commit suicide or death by suicide as a route. And we have seen an increase in death by suicides or attempts over this last quarter. Hadn't seen that in more than in one quarter, more than what we have seen in previous years. So we do believe that there is a real issue out there about people's ability to no longer cope, and feeling like there's no longer any hope, or not having being able to connect with others for help. So that, on our website, on your website, I know that there's information about, national suicide hotlines and how to connect for care. Common Ground, us locally, is our partner in that. They are our crisis center in our area. But if folks felt that they needed to connect right now, that number is 1-800-237-8255. That's the National Suicide Hotline. And please help someone get connected. That's something that's really near and dear to Easter Seals, and to the point where we're going through an initiative called, a Zero Suicide Initiative, where no death by suicide is acceptable. And we're training our community, working with our community partners, working with our staff, that we are more effectively addressing this particular issue. So there is help out there.
Thank you for that. And say that suicide prevention number again, please. The 1-800.
1-800-237-8255.
1-800-237-8255.
Yes.
Thanks. Thank you for that. That's very important. So I just want to thank you both for spending the time today to be, and especially you, Ms. Denise, for being very transparent and vulnerable and sharing your story. And I can just say it's a testimony of how you made it through. And I know that your words, your sharing of your experience is going to help somebody. And
Well,
I
hope so.
truly believe that.
Yeah.
Yes. And Julianna, I just thank you for being the wonderful professional that you are, for your love, care, and support for the people that you all serve in Michigan, for being such a fantastic resource, and for all of your colleagues and your CEO, Brent Worth, who I want to give a shout out to because he's just a great leader. But if there's nothing else, I just want to tell everybody again, if you direct them, actually go to our website, go to Easter Seals' website, which is at www.easterseals.com, and get access to all the great information that we have there for you. It's for you. It's for you, your support, for your care, because Easter Seals is here for you. That's what we're about. We are the hands and feet extended to help our fellow brothers and sisters. So thank you all so much for your time. Thank you for sharing. And